At the onset, I would first like to thank His Excellency, Mr. President, and Amai for their kindest reception, guidance and support in welcoming us to Zimbabwe. We had an aggressive program of meetings with various state authorities, visit to Victoria Falls, and site visits to the Harare Hospital and the Peri-Renatwa Hospital as well. And with these meetings, we have managed to boost our confidence, and we believe that now we are prepared to partner and invest in Zimbabwe. To begin with, we would be opening up 5 diagnostic and radiology centers in Zimbabwe in 5 district cities of Zimbabwe, starting with Harare, Mutare, Gaweru, Bulawayo, and Victoria Falls. These diagnostic and radiology centers will bring affordable healthcare to Zimbabwe. IHD Marketplace is already doing affordable diagnostics in India, and this is the same model that we want to replicate here in Zimbabwe. During my visits to these hospitals and clinics, what I gathered is that right now the cost of treatment and diagnostics in Zimbabwe is very expensive. So the people of Zimbabwe are unable to access timely treatment, and a lot of people, especially those with non-communicable disease, are going undiagnosed. So if we want to have a healthy future of Zimbabwe, we need to start with having affordable diagnosis of people of Zimbabwe. So with this intention in mind of bringing affordable healthcare to Zimbabwe, on 8th of March, IHD Marketplace will launch 5 diagnostic and radiology centers that will have state-of-the-art facilities, and the equipments will be equipped with new technology. Along with this, Zimbabwe at one point of time boasted of a thriving teaching hospital network and a strong primary healthcare network. So we already have a skeleton in Zimbabwe, and all we need to do is rebuild the health systems. And I think the time is right now, right here, until the able leadership of His Excellency Mr. President. I am sure with the good governance reforms and laws that are being undertaken, and what we gathered from our meeting with the authorities is that a lot of these incentives are being put through for the investors to create an investor-friendly environment that will go a long way in promoting what Mr. President stands for, is that Zimbabwe is open for business. And we are sure that when we leave Zimbabwe today, we will have this picture that Zimbabwe indeed is open for business. We also want to bring more women leadership into healthcare and empower the women of Zimbabwe who are hardworking and loving, and they are well educated. So with that intention also in our mind, we also propose to launch 10 pharmacy retail chain stores in Zimbabwe to begin with. These retail chain stores will be empowering women, because the ownership of these retail chain stores will be given to women pharmacists, and not just that, they will also be run by women pharmacists and along with their families and the extended support. So these pharmacy retail chain stores will be launched again on the 8th of March, which also marks the International Women's Day. We want to begin small, but definitely we want to make significant steps in improving the health infrastructure in Zimbabwe. And in the long run, we also intend to set up a world-class hospital in Victoria Falls that will become the hub of medical tourism in Victoria Falls and attract tourism from the neighboring countries of Zimbabwe and also go beyond Africa. I congratulate the government and His Excellency Mr. President for the proactive measures that the government has taken in controlling HIV/AIDS. And it's a good news for Zimbabweans that Zimbabwe indeed is on track in achieving its vision of reducing HIV infections by 2030. This demonstrated community resilience is what makes Zimbabwe a more robust healthcare compared to the sub-Saharan African region. And this is one of the strong reasons we want to partner with the government of Zimbabwe, because we feel that the optimism and the able leadership will also help us in changing the landscape of healthcare in Zimbabwe. Thank you so much.